Hello, my name is Adele and I'm one of the physiotherapists at Ashford Hospital. This short video will outline information to assist your recovery and reduce your risk of developing a chest infection after abdominal surgery. Please remember that the information contained in this video is general advice only. You should always follow any specific advice and instruction given to you by your surgeon. Every day, we breathe in thousands of bits of bacteria in dust particles and skin flakes in the air. This is unavoidable. The airways in our lungs have many tiny hair cells, cilia, with a thin layer of mucus on top that our bodies produce. Dust particles and germs that we inhale stick to the mucus layer. The cilia create a conveyor belt action and sweep the mucus back towards our throat where it would generally be coughed out or swallowed. It is normal to produce around 1/4 cup of phlegm every day without even realising. If we aren't able to clear these particles and this phlegm effectively, it can become a growth site for infection and can cause pneumonia. When you have any surgery to your abdomen, a number of changes occur that affect the way your lungs normally work. These changes occur due to a variety of reasons, including the location of your surgery, the anaesthetic, the effects of other medications, pain associated with the surgery, along with the fact that you spend more time lying down and not moving. These changes can last for at least 48 hours after your surgery, and they include your body producing more mucus than normal. The conveyor belt in the airways doesn't work as effectively. This actually doesn't start working properly again until you are up and moving around. Your cough reflex is less responsive and less effective. Your main breathing muscles don't work as effectively. Your lungs will be a bit deflated and your breathing will be more shallow than normal. This is why up to 50% of people can develop chest infections after abdominal surgery. Walking and getting out of bed as early as possible after your operation is the most effective way to prevent chest infections. Walking can also reduce your risk of developing blood clots, DVTs, pressure sores, and can help promote bowel function. You should start walking with the assistance of your nurse or physiotherapist as soon as possible after your surgery, certainly within the first 24 hours. This can even occur on the same day as your operation if you are well enough. The earlier, the better. When you wake up after your operation, you are likely to have some attachments. These may include a drip, catheter, wound drain, along with other monitors. These do not mean that you can't walk. It just means that you'll need some assistance, at least initially. Your nurse or physiotherapist will advise you when it's safe for you to walk on your own. Until then, please ask the staff for assistance. You should aim to walk out of your room at least 3 or 4 times a day, gradually increasing the distance. It's important to continue regular walks after you discharge from hospital to help regain your energy levels and aid your recovery. When you are lying down, your abdomen naturally tends to push up on your lungs, reducing the amount of air in the bases of your lungs at the end of each breath. When you sit out of bed, gravity helps move your abdomen down out of the way, allowing your lungs to fill with air more effectively, which is very important for shifting any mucus and improving your oxygen levels. You will be assisted to sit out of bed in a chair on the first day after your operation. You should aim to sit out of bed for at least 1 hour on your first attempt, with the goal to increase the number of times and how long you sit out of bed each day. Having an abdominal wound can make it more challenging to get in and out of bed due to discomfort when using your abdominal muscles. To make this easier and reduce the strain on your incision, when getting in and out of bed, we suggest to first bend your knees up. Moving your hips and shoulders together, roll to your side. Dropping your feet over the edge, push up with your elbow or hand to get yourself into sitting. Remember to use the bed control to assist with this part in the first couple of days if required. If possible, it's also a good idea to keep one hand over your incision and provide firm but gentle pressure during these movements. When returning to bed, we suggest the same technique, just in reverse. Deep breathing and coughing exercises are also important after your surgery, particularly in the first 24 to 48 hours when you're not yet moving as much as you would normally. Deep breathing exercises will help to reinflate your lungs and clear any secretions, especially while your airway conveyor belt isn't working as effectively. You should aim to start deep breathing exercises as soon as you wake up after your surgery. The earlier, the better. Research has suggested that the timing of the initiation of deep breathing exercises may be critical in the reinflation of your lungs after surgery. It is very important that you are able to clear your lungs of any phlegm to reduce your risk of chest infection. This can be uncomfortable due to the incision in your abdomen. Therefore, you will be provided with a folded up towel or a cough pillow to hold firmly over your incision whenever you cough. This wound support helps to reduce pain and allows you to cough more effectively. Whilst some pain is to be expected after abdominal surgery, it is really important that you are comfortable enough that you can move around, walk and cough effectively. If your pain is preventing you from doing any of this, please alert your nurse or doctor. Take 5 slow, deep breaths through your nose. Remember to try and expand the lower ribs while keeping your shoulders relaxed. Hold each breath in for 3 to 4 seconds. Do a couple of normal breaths. Repeat 4 times for a total of 20 breaths. Holding your cough pillow gently but firmly over your wound, do 1 huff and 1 strong cough. Pump your feet up and down 20 times at the ankle. Do this every hour during the day. It is easy to lose track of the time when in hospital. We don't expect you to set an alarm for your breathing exercises. It's normal to be dozing on and off. We do suggest having some sort of reminder. For example, this might be whenever the nurse comes to check your blood pressure, this could be your prompt to do your breathing and coughing exercises. Remember that the main message is, the earlier you get up and out of bed and walking, the better. The more you get up and out of bed and walking, the better. It's important to remember that your wound and abdominal muscles will take approximately 6 weeks to heal after your operation. Therefore, in the meantime, it is important to reduce excessive strain on your incision. We suggest avoiding lifting, pushing or pulling anything heavier than 5 kilograms for the first 6 weeks after your surgery. After that, you can start a gradual return to normal activities if your surgeon has advised that it is safe to do so. It's a good idea to check with your surgeon when you are safe to return to driving a car. We hope you have found this information helpful and wish you all the best for your surgery and recovery.